Good afternoon. Shall we start? Okay. इस slide को at least keep in your mind for another month or two. Clear? We'll just talk over these things. Okay. When we'll do blood smear or blood film, we'll get a film or a smear in which the different cells will be seen under microscope. Okay. So what are the points or what are the things on basis of which you will be able to distinguish different WBCs? बुक क्यों खोलती है? बुक घर से खुला कर, ठीक है? Okay, when you see a blood film or a smear on when we focus it on heart rate, the number of cells, maximum number of cells which we see under microscope is RBC. The size of RBC is 7.2 micron. Okay, because the number of RBCs run in millions. Okay, so when we get a field, means the thing which we have focused on a microscope. Okay, in that particular field, you will be able to see 2 or 3 rare WBCs out of 500 RBCs. But the point of identification which you have to keep in your mind for another 2 months, so that when we come to practical, we'll be able to see that this is WBCs. बोलना मत कि थ्योरी में नहीं बताया या ये नहीं हुआ. This is repetition. Okay, again you will get the repetition in demonstrative class, then you will be coming into the laboratory and see these different WBCs. Okay, first and foremost, the size that is compared with RBC, the size of granulocytes, that is eosinophil, neutrophil and basophil, they are 1.5 times that of RBC. The size of RBC is 7.2, so size of granulocytes will fall at 10 to 14 microns. Okay, how to remember it is, it will be 1.5 times that of RBC, 10 14 microns. Okay, simple. Another thing is, the biggest WBC is monocyte, so it will be till 18 micrometers. That might be the size of monocyte. Next comes lymphocyte. Lymphocyte, when we are focusing it under microscope, they are divided into 2 types, small and large lymphocytes. Clear? So large and small lymphocyte. The size of small size lymphocyte is equivalent to RBC, that is, it is roughly 8 microns. Okay, and the size of bigger lymphocyte or the large lymphocyte is again 1.5 times that of RBC. So first important identification feature for WBCs is their size. Size, we are comparing it with RBC to remember it, to make it easy for us to differentiate it from RBC. Clear? Then comes the nucleus. RBC does not have any nucleus. Okay, WBC, they all are nucleated cell and they will be taking stain. Okay, the stain which we use is Leishman stain. So the composition of Leishman stain, that will do in practical class, but the nucleus takes separate color and the granules will take separate color. Okay, the only granulocyte which is having fine granules, okay, is neutrophil. The only granulocyte which is having fine granule is neutrophil. तो ये एक अलग चीज होगी. Clear? The granulocytes which are having coarse granules is eosinophil and basophil. But the color of granules make them very easy to identify. If it is eosinophil, means it is loving eosinophil dye. So it will take red color dye. So the granules will be coarse. Coarse means they will be bigger in appearance, size, and the color will be brick red. Nucleus will be 85% it is bilobed. Rarely it might be of trilobed nucleus. Clear? You have a chart in your theory book, you have a chart in your manuals. Everywhere the chart is given to identify these cells. Okay. Then comes the picture of basophil. In case of basophil, blue color, coarse granules, nucleus S-shaped. Maximum the nucleus is obscure or covered by blue color granules. So broadly, WBC granulocyte, A granulocyte, on what basis we are categorizing it? On the basis of the stain which they take, they are divided into A granulocyte and granulocyte. और granulocytes को याद करने का तरीका है, the only granulocyte which is having fine granules, neutrophil. We having coarse granules, maybe eosinophil, maybe basophil. But the prominent distinguishing feature is the color of the granules. Okay, in your exam you get focus and eosinophil, focus basophil, okay, focus trilobed or tetralobed neutrophil. So you should be able to differentiate it. When we are talking of neutrophils, if you remember, the role of blood film is one of the important function is for sex determination. The bar body is present on the nucleus of the neutrophil. Okay, so that will be covered in practical class. Plus, you should know it in theory also. So this is also one of the clinical aspect or the applied aspect when we are dealing with neutrophil. Clear? Neutrophil, eosinophil, basophil. When we are talking of lymphocyte, please remember the small lymphocyte is the mature lymphocyte and the size is equivalent to RBC. Maximum area of the cell is occupied by the nucleus and the cytoplasm is crescentic shaped. Okay, it will have a crescentic shaped cytoplasm, very less in quantity. That is the distinguishing feature of small lymphocyte. When we are talking of large lymphocyte, the nucleus will be round, placed centrally, okay, and the cytoplasm has a ring around the nucleus, only a ring. So if the ring is present and the nucleus is present centrally, that means it is a large lymphocyte. Okay, एक फीचर तो क्या हो गया अपना सबसे इम्पोर्टेंट साइज. साइज के बाद में आ गया न्यूक्लियस. न्यूक्लियस सेंट्रली प्लेस्ड है या इसेंट्रिकली प्लेस्ड है. साइटोप्लाज्म का रेशियो कितना है. साइटोप्लाज्म केवल क्रेसेंटिक शेप्ड है, स्लाइटली है, तो क्या हो जाएगा वो स्मॉल lymphocyte. If it has a ring around the nucleus, it will be large lymphocyte. Okay. Another last important cell is monocyte. It is one of the biggest cell, okay, WBC का maximum size, but it is not 100% rule कि सबसे बड़ा सेल होगा. वो आपके स्लाइड के ऊपर डिपेंड करता है, मेच्योरेशन की किस स्टेज पे उसको आपने फोकस हुआ है. ठीक है, किस मेटाबॉलिक स्टेट में अपन ने उसको स्लाइड पे फिक्स किया है. ओके, so depending on all these conditions, but the prominent feature is the nucleus is 100% indented. Okay, it will not be a regular rounded nucleus, it will be indented nucleus, maybe horseshoe shaped nucleus. Clear? So these features you have to keep in your mind, keep repeating these identification features, so when you come into the lab you will be able to identify. Clear? ठीक है, याद रहेंगे ये पॉइंट. अभी आवाज नहीं आ रही तो बाद में तो क्या आएगी. Yes, so we are over with WBC in theory section. You have already done TLC. Next you will do TRBC, then you will do platelets. Okay, immunity we will take in the last section. Right now we are starting with hemostasis, thrombopoiesis, structure and properties of platelets. Another important question you get is describe the structure of platelet, add a note on hemostasis. Define hemostasis, add a note on structure of platelets or the function of platelets. When this question is asked in Viva, the only answer which is given is the platelet helps in coagulation. Okay, but this is not the only answer. Okay, so learning objective is define hemostasis, list the major steps of hemostasis. You get a separate question on hemostasis, you get a separate question on clotting mechanism. Okay, appreciate the principle of temporary hemostasis. What is temporary hemostasis? We'll see. Understand the role of platelets in temporary hemostatic plug formation. ठीक है, आज ये 3 ऑब्जेक्टिव ही करेंगे so that it will be clear, and because it holds a very important mechanism. So in next class we'll complete the clotting mechanism. Today we'll do only the primary hemostatic plug formation. Okay, definition is defined as the process of arrest of bleeding while maintaining the blood in a fluid state. That you get them. Okay, while maintaining blood in a fluid state within the vascular system. Okay, it is the mechanism by which loss of blood from the vascular system is prevented by a complex interaction of vessel wall, platelets and plasma proteins. This broadly happens in 2 stages, primary and secondary. Okay, now to proceed with this hemostasis mechanism, okay, is hemostasis occurring naturally in our body? Yes. Physiologically, in the vessels, the blood is freely circulating. It is not getting formed as plug or clot. Naturally. Naturally तो नहीं होना चाहिए. Until unless some injury or trauma has taken place, it should be flowing, freely flowing in the vessels. Blood has to flow. But the main component responsible for hemostasis are already present in the blood. They are present in the blood. Okay, they are present as platelets, they are present as plasma proteins and various clotting factors in the tissue. Okay, but still they do not make a clot or a plug. So the fibrinolytic mechanism already exists in the blood. So this balance is maintained. So certain factors are present in the blood which do not allow the platelets to become activated. So for hemostasis to take place, okay, the platelet has to become itself active. भाई क्या ऐसी चीजें हैं जो प्लेटलेट को रेगुलर फ्लो में तो इनएक्टिव कर रही हैं? Until unless an injury takes place, the platelet does not come into picture or does not become active and results into formation of plug or a clot. Okay, so platelets, how they are formed, how this property of platelet is maintained, okay, how all these things are kept in consideration. So when we are talking of the structure of the capillary, we have the endothelium lining. Okay, next to endothelium is the collagen fibers, connective tissue. Next to is the muscular layer. Okay, this is the sequence or the structure of the capillary. Okay, endothelium, collagen fibers and the muscle layer. Okay, the myocytes are present. Nitric oxide, okay, and prostaglandins, they are present at the surface of endothelium. They are responsible for inhibiting the activity or activeness of the platelets. Okay, the endothelium lining, these cells, what they are doing is they are secreting these 2 basic chemicals. So these 2 basic chemicals, what they are doing, they are arresting the activity of platelet. So in regular flow, they inhibit the formation of plug or the clot. So how they inhibit? By secreting it. From where it is getting secreted or coming? It is coming from the endothelium of the capillaries. So when they are present in the blood, they will not allow the platelet to become active and result into the formation of plug and finally into clot. Other than this, there are certain chemicals present, thrombomodulin, that will combine with another protein, so that will also inhibit the activity of clotting factors which are present in plasma. Total clotting factors are 13. These clotting factors are present, but they are not present in active form. They are present in inactive form. So certain chemicals, receptors, their combination, they are responsible to keep them in inactive form. So when they are present in inactive form, they will not form any plug or clot. Okay, but due to some injury, trauma, if there is plug and clot formation, that has to be dissolved, that has to be removed from the normal circulation. So another mechanism which is present is known as fibrinolytic mechanism, that is breakdown of the fibrin. Fibrin is the final product of the clotting mechanism, so fibrinolytic mechanism. Rarely asked is add a note on fibrinolytic mechanism. What a student read is till formation of fibrin, but rarely it's been asked in your theory papers fibrinolytic mechanism. So when you read fibrinolytic mechanism, there the theory section of platelet gets complete. So today we'll only read how the temporary hemostatic plug formation taking place. What are the factors which are responsible? Here, okay, hemostasis defined as process of arrest of bleeding while maintaining blood in a fluid state within the vascular system. So definition cannot be changed. Definition is definition. Okay, hemostasis is the mechanism. Mechanism is different by which loss of blood from the vascular system is prevented by a complex interaction of vessel wall, okay, that is endothelium, collagen fibers, myocytes. Along with the myocytes, you have nociceptor receptors which are responsible for pain sensation. So they will also come into picture, okay. Platelets and plasma proteins. This happens broadly in two stages, primary and secondary. Primary hemostasis, initial stage during which vascular wall and platelets interact to limit the blood loss from the damaged vessel. When there is no damage to the vessel, the endothelium is smooth. When it is smooth, it has a layer of glycoproteins. So these glycoproteins and this smooth layer, they are also assisting in inactivation of platelets. क्या हो गया? With another class, we'll finish the major topic of blood. Okay, so be prepared for class test anytime. Clear? Once we finish with this clotting mechanism, be prepared for the class test. क्या हुआ, नींद आ रही है? सिर दुख रहा है? जाओ. नहीं जाओ. If you are not mentally and physically fit, okay? ठीक है ना? अटेंडेंस के लिए बैठे हो ना, तो वो तो साल भर बैठना पड़ेगा. अच्छे. Okay? Secondary hemostasis, a stable fibrin clot is formed from clotting factors by enzymatic reactions. This is called definitive hemostasis, okay, as formation of clot in the vicinity of platelet plug. Once the platelet plug is formed, and another is definitive hemostatic plug. When the clot is formed, fibrinolysis mechanism takes place. Bleeding occurs when blood vessels are damaged, okay. They initiate a series of events in sequence that finally forms clot at the site of injury, prevents loss of blood. Hemostasis is a life-saving process that maintains homeostasis of blood volume. What do you mean by homeostasis? And how this statement is true? Homeostasis, I think, आपका हो गया है? Theory में हो गया ना homeostasis? So how is this statement true? Is this statement true or false? First of all, true. How many you are saying it's true? Rest do not support this statement. Hemostasis is a life-saving process that maintains homeostasis of blood volume. थ्रोम्बोस की बात ही कहाँ हो रही है? क्लॉट फॉर्मेशन की बात हो रही है अभी. तो फिर कभी होगा ही नहीं. अगर आपकी कोई ट्रॉमा इंजरी हो गई तो your body will allow to bleed continuously. No, it has to make a clot. It has to arrest the bleeding. Why it has to arrest bleeding? फिर what do you mean by homeostasis? Homeostasis is maintenance of internal environment of the body. So that includes pH regulation, ionic regulation, temperature regulation, okay, fluid volume. So arrest of bleeding is a must if a person is under trauma, surgery, okay. Continuous bleeding is a dangerous fatal condition. It has to be stopped. Thrombus formation is a later step that will be prevented by giving drugs. So until unless you get the mechanism of how the clot is getting formed, you'll not be able to apply it in pharmacology because the receptors and the chemicals and the mechanism is not clear. In pharmacology, you will only just रटना जिसे कहते हैं ना वो रटते रहोगे because you have not been familiar with the mechanism. Unless you are familiar with the mechanism, you will not be able to apply the medicine on that particular condition. Here, in the next section, we will see the use of aspirin. Okay. Steps of hemostasis occurs in 3 stages: vasoconstriction, temporary hemostatic plug formation, and blood coagulation. When there is vascular injury, there is mechanical vasoconstriction. Okay. Endothelium gets damaged, so the collagen gets exposed. Okay. Release of tissue thromboplastin. Okay. For the mechanical vasoconstriction to take place, okay, when the endothelium gets damaged, it releases a substance that is known as endothelin, and this endothelin has a role in contraction. Okay, so that will help in vasoconstriction, decrease in the blood flow. Okay, so first step for arrest of bleeding is there has to be vasoconstriction. For vasoconstriction to take place, there are different sources. One of the sources is when the vessel gets damaged, okay, then there is exposure or damage to the endothelium lining. Endothelium releases endothelin. This endothelin goes to the myocytes, okay, then these myocytes will be responsible for the vasoconstriction. Clear? Another mechanism is in the muscular layer there are nociceptors present. So when there is damage or injury to the vessel, okay, the inflammation will take place. The chemicals will be released: serotonin, bradykinin, leukotrienes. Okay, these will be resulting into the stimulus of nociceptors or the pain stimuli receptors which are present, and this will result into nerve reflex, and this neuronal reflex will be responsible for vasoconstriction. So there are different sources responsible for vasoconstriction. One of them is the release of endothelin. One of them is the neuronal reflexes, nerve reflexes. How this nerve reflexes is coming into scene with the help of nociceptor receptor, which is present in the muscular layer. And how it is getting stimulated? It is getting stimulated by the chemicals which are getting released at the site of inflammation, like serotonin, bradykinin, and leukotrienes. Okay, these are the certain examples which are the chemicals which are responsible for neuronal pathway of vasoconstriction. Clear? हाँ या ना? फर्स्ट स्टेप क्या हो गया? वेजोकंस्ट्रिक्शन. और वेजोकंस्ट्रिक्शन के लिए भी नंबर ऑफ रूट्स है. उन नंबर ऑफ रूट्स में से एक तो एंडोथेलियम का हो गया, एक हो गया आपका न्यूरोनल पाथवे, ओके, दैट इज रिस्पॉन्सिबल विद द हेल्प ऑफ नोसिसेप्टर रिफ्लेक्सेस. ओके, then collagen exposure takes place. Okay, then comes the surface which was smooth in regular flow has now been, the smoothness has been removed. Okay, So now with the help of von Willebrand factor, okay, there will be binding of the platelets. So there are special receptors which are present at the surface of platelets. And when they get attached to this von Willebrand factor, there is more of the platelets coming at the site. Okay, so platelets will be attracted, their size, their structure will be deformed. Okay, they will increase in size and they will be binding with each other. Okay, so there are certain chemicals which are responsible for first binding with the von Willebrand factor and then with mutual platelet binding. तो दो तरह के अलग प्रोटीन्स रिस्पॉन्सिबल होते हैं. एक होता है जो कि वॉन विलब्रेंड फैक्टर से बाइंड करेगा. व्हेन इट गेट्स बाइंड विद दिस, another protein which will act is with the binding of the mutual platelets. So when there is binding with the platelets, then they will be resulting into accumulation of platelets at that injured site, resulting into the formation of temporary hemostatic plug. ठीक है, 3 स्टेप्स में अपने हेमोस्टेसिस को डिवाइड कर दिया फॉर द स्टडी, एंड दैट 3 स्टेजेस आर द वेस्कुलर constriction and collagen exposure resulting into the temporary hemostatic plug formation or temporary hemostasis. Okay, platelet adhesion, aggregation and platelet activation and release. platelet release को secretants भी बोलते हैं, platelet secretions. Okay, इस पे MCQ आया हुआ है इसलिए बता रही हूँ, ये भी एक वर्ड है. Okay, and release of this tissue thromboplastin, activation of clotting, this will take in next class. Vasoconstriction, contraction of vascular smooth muscle in response to injury. Okay, mechanical response, stretch induced contraction. तो बोल्ड है, उसके ऊपर ध्यान देना जरूर से. Secretion of vasoconstrictor substances like serotonin from the activated platelets. At the site corner, this हो गया. 3 properties है, addition, aggregation and release reaction, that is known as secretion. Please focus on this. The initial response of platelets to vascular injury is change in the shape of platelets. It increases in its size. Okay, increases surface adhesiveness to the injured vascular endothelium. This is called adhesion. Adhesion क्यों possible हो पा रहा है? Because there is increase in the size of platelet. When there is increase in the size of platelet, there will be increased surface adhesiveness. Okay, platelets stick to each other, mutual, at the site of injury, that is known as aggregation. This is the third stage that is taking place. That arrests bleeding temporarily. Okay, not a stable one. This is not a stable one, temporary है, so we have to make a permanent arrangement. If the vessel injured is a capillary or a minute vessel, then it will be within minutes, it will be done. If the vessel injured is a bigger one, then it will take longer duration and the mechanism has to take place of permanent hemostatic plug formation. Okay. This is coagulation. Thrombopoiesis, that is formation of platelets. Okay, so which cell is responsible? Is hemopoietic stem cells. Next comes megakaryoblast. Okay, factors responsible is colony stimulating factor. Okay, megakaryoblast, colony stimulating factor. This can, when it enters into the blood, okay, because of its bigger size, automatically it gets fragmented, resulting into disc-like structures. They are known as platelets. The size of platelets is 2 to 4 microns. कितना साइज रहता है? 2 to 4 microns. जब आप ब्लड फिल्म देखेंगे माइक्रोस्कोप में तो प्लेटलेट्स कैसे दिखेंगे, ग्रुप में दिखेंगे. Okay, dark blue in color and they will appear in groups, the platelets. Okay, they are the giant cells in the bone marrow. Pluripotent stem cells, committed stem cells, colony forming unit, megakaryoblast. Okay, promegakaryocyte, फिर granular megakaryocyte, mature and platelets. These are the stages of thrombopoiesis. Megakaryopoiesis, formation of platelets from megakaryocytes. Mature megacytes, these are the largest cells. Polyploid bone marrow cells. Ploidy means DNA content. Diploidy means double amount of DNA. Okay. Polyploidy means increased amount of DNA in the nucleus. They are the large nucleated cells. These cells are still bigger in size, more than 25 to 50 microns. Cytoplasm contains numerous granules of different kinds. Now here comes the picture of structure of platelets. Another important question is structure of platelet. So in that structure of platelet, you have to write down what are the different granules and what are the different proteins present in platelets. These are the different granules, 4 types of granules. They have been described in this megakaryocyte. Alpha granules, dense granules, lysosomal granules and myeloperoxidase granules. Though the size of platelet is very small, but its structure, its function is more pronounced or most important. Okay? Most of the proteins and granules determine the characteristics of platelets. Increase in size, granules are present around the centrosome. The nucleus is reduced in size. जो अपन ने सब में पोएसिस में देखा वो सारे फीचर्स देखने को मिलेंगे. Finally, the nucleus will disappear and the megakaryocyte, okay, will break down into platelets. Each megakaryocyte produces about 1000 to 3000 platelets. MCQ, okay. From where the platelets are getting formed? From the pinching of bits of cytoplasm, extruding them into the circulation. Okay, formation of platelets. Production per day is 35,000 to 45,000 per microliter. Lifespan of platelet is? Lifespan of platelet last last benchers बहुत intelligent होते हैं. They discuss among themselves so much, so they know much more than us. Next, खड़े हो जाओ. Next, 80 days. Next. Next. सात से 10 दिन. Next. पीछे 5 to 7 days. Next. Had your lunch? जोर से बोलो. 10 to 12 days. If I remember in last class I have given you the average lifespan of platelets, that was for 10 days. If the average is 10, should mean 8 to 12 days. Okay, in all the counts we have range and we have average. So your concept should be clear, whether it is asked the range or average. The average lifespan of platelet is 10. Okay, and the range is between 8 to 12 days. Sit down. Okay, as we can see clearly in this picture, the size of the cell is getting reduced as the maturation is taking place, growth is taking place. Finally, there is decrease in the size, the nucleus is getting disappeared, and the platelets, they are getting formed. They are the disc-like structures which are getting fragmented from this megakaryocyte when this megakaryocyte or the platelet that has to enter into the circulation. Okay, this is the story of platelet. How it is regulated by granulocyte monocyte colony stimulating factor control thrombopoiesis. Okay, this indicates that a feedback regulatory mechanism exists. What do you mean by feedback regulatory mechanism? What is the scenario in dengue? In dengue, the platelet count is getting affected. The clinician is asking for a platelet count. Until unless the platelet count goes critically below 50,000, the platelet has to be transfused. Okay, it is always asked to transfuse a fresh donated blood. Okay, so the components of the blood which has to be transfused, that lifespan we need to have the idea. So 50% is present in the bone marrow pool and 50% in the circulation. On circulation, what are the active stages? So always the platelets, they are transfused in fresh blood. Okay, from the fresh blood it is being donated. Clear? So what are the factors? If it has been decreased, then these factors which are controlling thrombopoiesis, they send strong signals to form platelets. So that is a negative feedback mechanism. When it is going down, the controlling factors will increase, ask the responsible site to release more of the platelets. Okay, count is going down, that has to be increased. Okay, the regulatory mechanism. So important is thrombopoietin, erythropoietin. So responsible is thrombopoietin, interleukins 3 and 5, and colony stimulating factor, similar to that of granulocyte. Okay, thrombopoietin, it is getting released from the liver. From where the thrombopoietin is coming? It is coming from the liver. Okay, then recombinant thrombopoietin have half-life of 20 to 40 hours. From where it is getting formed? Produced by monocytes, lymphocytes, fibroblasts, and endothelial cells, and it stimulates erythropoiesis, granulopoiesis, and thrombopoiesis. But the question is, from where it is getting produced or coming? Life history have the half-life of about 4 days. They survive in circulation for 8 to 12 days. Okay, the aged platelets are removed from circulation by reticuloendothelial system, and 50% is getting removed by the spleen. Okay, spleen plays an important role in destruction of platelets. Therefore, platelet count increases after splenectomy or the removal of spleen and decreases in splenomegaly. Okay, emphasis on these two conditions for problem-based questions. Destruction is taking place in reticuloendothelial system. Out of 100%, 50% of this destruction takes place in spleen. So if there is any problem to the spleen, that is going to affect it clearly. They are the small anucleate cell fragments adapted to participate in hemostasis. क्या टाइम हो गया? सबकी घड़ियां अलग है क्या? So we'll conclude in next class the structure of platelets. Okay.